No, I would encourage people not to panic. You know, this is something we've been preparing for a while. We suspected that we would see cases in our area, so I would encourage people to stay calm. I think there's been a lot of preparations in the community. There have been a lot of preparations in healthcare facilities, both on ramping up the things we should be doing every day, encouraging people to wash their hands, encouraging people to stay home when they're sick, and good respiratory etiquette, so covering your cough and sneeze. Those are basic principles that apply whatever setting we're in. In hospitals specifically, we're working to make sure people have access to the appropriate avenues of care, so trying to encourage people that don't need to be in waiting rooms and healthcare facilities to try to use other methods of care. So virtual care or e-visits are great opportunities to get good medical care without having to wait in waiting rooms to see a provider. And then making sure our hospitals are prepared for a potential increase in number of patients with flu-like symptoms. A lot of it's what we do every flu season, so making sure as people come in the door, if they have flu-like symptoms, that they're given a mask so that they're not potentially spreading to other patients, making sure we have good protocols for identification of people at risk and isolating them promptly, using the appropriate personal protective equipment for healthcare workers to keep them healthy and prevent them from kind of having any other issues with patients. The case in Wake County is someone that traveled to Seattle and visited a nursing home with an active outbreak, right? So it's not, the good news there is that it's not someone that we have no idea how they got it. It's a pretty clear, she was exposed, she's some part of an exposure workup. I think it won't be that long before we see cases in the Charlotte area, and that's not something that should cause people to freak out. That's just, you know, this is the way that infection is progressing across the country, and that we, instead of kind of responding with panic, responding with preparation and making sure you're ready for when it comes. So younger people seem to be relatively protected, at least from the data we're seeing from China. You know, there have been some children with cases here so far in the United States. You know, the people most at risk are with any infection, older people, people with other medical problems. So for those people, it really is like paying attention to washing your hands, staying away from people that are sick. You know, if you have people in your household that are ill, separate yourself from them. It's really that close contact that you're worried about with people kind of at home, you know, healthcare obviously being a slightly different scenario. So the government is kind of rapidly changing the requirements surrounding testing. So previously only the CDC and then whoever they released testing kits to, which in North Carolina was primarily the North Carolina State Lab. North Carolina did get up and running with their in-state testing yesterday, so that certainly will improve accessibility. And then a number of places are working to get testing closer to home so that we can improve access to testing. For right now, the primary populations who are recommended to be tested are those severely ill in the hospital without another cause, or those with those links with travel to an area that's having markedly increased number of cases and have flu-like symptoms.